Kane, and I'm here to talk to you about HIT 330, health information technology, and all that sort of good stuff. We are still on week 12, and this is for chapter 5, clinical terminologies, classifications, and code systems. This is the second lecture video for HIT 330, week 2. So let's dive into it and see what we've got. If you look at your syllabus, really quick, I guess I need to go back and cover that. We are on unit objectives 9.8.1 through 9.8.6. So that's 9.8.1 through 9.8.6. And that's what you'll want to look at with this. Some definitions. Vocabulary and terminology. Those are a set of terms specific to a domain. Nomenclature is a system of names that follows pre-established conventions. And classification is a mono-hierarchical method of organizing related terms together. If by chance you have cracked open your textbook, we are starting off chapter 5 on page 123. Really page 124, but if you want to go to page 123 or 124 in your book, it's going to have these terms in here. And I am going to tell you, you do need to know these for your quiz. So if you're not sure, make sure that you do flashcards or Quizlet or however you want to study, but you're going to need to know these terms, and they're on page 124. And you can also look in your glossary at the back of the book. Code. A code is an identifier. That's really all it is. It's just an identifier. A code set is an accumulation of numeric or alphanumeric codes. And a code system is an accumulation of terms and codes for exchanging or storing information. So again, you need to know these definitions really well. Clinical terminology. This is a set of standardized terms and codes used in the healthcare industry to encode clinical data. And again, another one you really need to know. So what about the history and importance of these systems and codes and content and all this other stuff? Well, starting at the bottom of page 124, it really goes into the history behind this. So I'm not going to go too deeply in this, but I will say that originally when they started thinking about clinical terminologies, classifications, and code systems, it was to identify causes of death. Across the United States. They really didn't have much data specifically for public health, but also as well for just basic statistics that we take for granted today, vital statistics, births, deaths, those types of things. So they wanted to identify, they knew people were dying, but they wanted to identify causes of death. So that's really where this started coming in. And then from there, it expanded to being used for patient care, measuring patient outcomes, research, and claim submission for reimbursement. But again, it was initially for cause of death. And really it started, I don't know, do they give a date in your textbook? I'm not really seeing a date here that they talk about. But probably mid 1900s is when they really started getting serious about this. So what are some expanded uses in data capture? Well, there's claims data and there's EHR data, electronic health record data. Claims data just gives you surface clinical content, really what's being billed for, because claims are your billing piece. The EHR really gives you the detailed clinical content, but both are important. In terms of data capture, details are the key to use. You want to get as granular as possible when it comes to clinical terminologies and code systems. You want to get down to where you can really truly have a code that identifies a very specific situation or definition. A combination of data is sufficient if you're talking aggregation, and that's where you get into classifications and code systems. And this really is covered at the top of page 126 in your book. And it gives you a nice table in 5.2 examples of data uses and the requirements. So that's something to go back to and take a look at if you're struggling with this concept. primary and secondary data use. Primary use means that you're using direct patient care information. It's granular. You're using it for patient care decisions. It's from the primary source. Secondary use is more of an aggregate situation. Secondary use usually comes from data that's being used for another purpose. It can be from clinical data, but you're aggregating it. It's not, you're pulling multiple pieces together, and it's usually for non-patient care purposes. It's for billing and payment. It's for research. It's for all those other things. So please make sure you know what primary use means and secondary use. Selection of a standard for reporting. At one point, it got to the point where there were multiple systems out there, and in order to move forward with interoperability, they had to develop a standard system and say, okay, these are the ones we're going to use, and only these. We're not going to use just anything and everything. And that's where they came in to saying, okay, we've now got content standards for representing EHR information or electronic health information. We're going to regulate that these are our standards for reporting. And again, the purpose behind that was interoperability. Clinical terminologies form the basis for coded data. They provide the data structure. They give semantic interoperability and permit and promote health information exchange. And this is at the bottom of page 126 in your book if you're wondering where this is at. There are also reference terminologies that provide common semantics and support meaning-based retrieval, and SNOMED is a great example of this. And there's SNOMED starts on page 127 and goes through into page 129. You need to make sure that you're familiar with SNOMED and its major characteristics, that you understand what SNOMED is, how it's used, those types of things. So SNOMED is a clinical terminology used for documentation and reporting. There's no book of codes and no assignment by a coding professional. It's implemented in software applications, and it's a granular level of clinical data capture, so it's primary use. The purpose is to standardize clinical phrases. It's used for sharing clinical information. It is a standard system for certified EHR systems. Its structure is made up of 3 items: concepts, descriptions, and relationships. So make sure you know that. The structure of SNOMED is made up of concepts, descriptions, and relationships. The SNOMED identifier is a unique integer. It includes an item identifier, a partition identifier, a check digit, namespace identifier, and is non-semantic. And I will tell you, I don't think our quiz gets into this much detail, but it's good for you to at least be introduced to SNOMED in this class, because eventually you will study it in other classes. But this is really just meant to be a basic introduction to SNOMED. And please make sure you keep your textbook, because we will refer back to it, and you will especially appreciate it at the end of your second year when you are studying for your RHIT certification exam. You will find that going back to this book, suddenly it makes ever so much more sense, and it's very, very clear, very concise about things. I know that seems impossible now, but trust me. All right, some concepts when it comes to SNOMED concept definition. It's considered sufficiently defined, although it's also partially defined, which is also known as primitive. And again, I don't think this is on your quiz, but it's probably worth at least knowing. Maybe not memorizing, but at least being familiar. In terms of SNOMED, there are descriptions, because we talked about that. Remember, we talked about how it's concepts, descriptions, and relationships here. So we talked about concepts, that it's sufficiently defined, and it's also partially defined, which is also known as primitive. In terms of descriptions, it's fully specified, and there are synonyms, which are preferred terms. In terms of relationships, it has a connection between a source and destination, and it helps form the polyhierarchical structure of SNOMED is a relationship type. I would say on this slide, just know that it's a connection between a source and destination concept, and it's a relationship type. CPT is the next one we're going to talk about, and CPT starts on page 129 in your book. You will become very familiar with CPT. Some of you may already be in Shelley Grant's Intro to CPT, so some of this information is going to be very familiar to you already. But CPT is a nomenclature used for reporting procedures, for reporting outpatient procedures, physician procedures, physician care, all sorts of things like that. You can get it in a paper version that's spiral bound, an ebook, or in software applications. These CPT codes are assigned by a professional coder, and they are a standard for certified EHR systems. They provide a uniform language for services and procedures. They report services and procedures on healthcare claims. Again, no excludes inpatient claims. So you do not use CPT codes on hospital inpatient claims or hospital inpatient procedures. It's only for everything that's non-inpatient. Although the inpatient piece that it does include are services and procedures that are performed by, how do I say this? So for instance, let's say you are in a hospital and you are tagging along with a doctor today, and the first patient he goes to see is an inpatient, and the patient's just been admitted and he needs to do a history and physical report. He is going to, after he completes his inpatient history and physical admission activities, when he goes to record that or bill for that, he will be using a CPT code for that. So that's an example of where it's not an inpatient, it's not on the hospital's inpatient claim, but the physician will be billing for it to report his services, his or her services. But CPT is not used on inpatient hospital claims. It is used on everything else. Structure. The structure of CPT has codes, descriptions, and guidelines. There are Category 1, Category 2, and Category 3 code. Or I'm sorry, there's Category 1, Category 2, and Category 3, as well as modifiers. And I'm shocked that that's all that they tell you on this slide about CPT. You need to know that CPT is owned and maintained by the American Medical Association. You need to know that it's published annually. Typically comes out January 1st of every year. Sometimes they will publish updates on the interim. It is, let's see here. You need to know that the Category 1 CPT includes 6 main sections, and those sections are E&M, Evaluation and Management Codes, Anesthesia, Surgery, Radiology, Pathology and Laboratory, and Medicine. And this is on page 131 in your book. You need to know that. Hint, 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 I will tell you. Category 2 is what are called HCPCS codes. And those are developed and maintained by CMS. So make sure that you know that. Because CPT Category 1 is by AMA. CPT Category 2 is HCPCS, and that is by CMS. And let's see, is there anything else here that you might want to know? I'm sure Shelley covers so much in her class that a lot of this is probably repetition, but at least you're aware of it. Nursing terminologies. This is terminology that's used to report nursing care There are multiple terminologies available. They have their content, structure, and purpose varies. Some examples they give you here are the nursing interventions classification and the nursing outcomes classification. Classifications are key to secondary data use because they aggregate clinical data, permit the collection of healthcare statistics, determination of payment, monitor public health, and improve financial performance. So let's move on to ICD-10, and that is on page 133 in your book if you're following along. ICD-10 is International Classification of Diseases, 10th revision. In the United States, we use ICD-10-CM and ICD-10-PCS. ICD-10-CM is clinical modification. It's developed and maintained by the National Center for Health Statistics, NCHS. You need to know that. You need to know that ICD-10-CM is developed and maintained by NCHS. There's also other committees and other organizations involved, but NCHS is the owner, so to speak, of ICD-10-CM, which is diagnosis coding, diagnosis only coding. And it's used in all settings, inpatient, outpatient, skilled nursing, inpatient rehab, hospice, all those, they use ICD-10-CM for diagnoses. It's updated every October 1st and sometimes every April 1st. It's available print, which is paper book with spiral binding, online, and in software applications. And again, you probably get all of this information on ICD-10 through Shelley Grant, but it's covered here, and it's just here again as a snippet of an introduction. So hopefully this dovetails with what you're already learning. ICD-10-CM, they are typically codes assigned by a professional coder. They're used to report diagnoses on healthcare claims. And the structure is there's 3 to 7 characters. ICD-10 procedure coding system is ICD-10-PCS. This was created by 3M, but is owned and maintained by CMS. Make sure that you know that it's owned and maintained by CMS. This is ICD-10-PCS. This reports procedures for inpatient claims only. ICD-10-PCS codes are never used for anything other than inpatient surgeries, inpatient procedures. They are not used for anything outpatient. They're updated in October and whenever necessary April, because ICD-10-CM and ICD-10-PCS usually are together. They're usually released together and just all of that. You can get it print, which is paper book, spiral bound. You can get online or in software applications. ICD-10-PCS is always assigned by a professional coder. ICD-10-PCS, you will learn to do that in this program, and you will understand why it's only done by a professional coder. This is not for the amateurs. It's a 7-character code system, so all the codes have 7 characters. There are sections, medical and surgical procedures, medical and surgical related procedures, and ancillary procedures. There are tables, indices, and definitions. ICD-11. We just started ICD-10 October 1st of 2015, and already ICD-11 is alive and well in certain parts of the world. When it's coming here, we're not quite sure. If you look at page 136 in your book, you can see about ICD-11. ICD-11 is owned by WHO, or the World Health Organization, or you can call them WHO. That's perfectly fine as well. They have a foundation component. And where does it talk about that in your book? Let me see here, foundation component. That should be one of those that's in a different color. Oh, it's not, but it's the very first sentence under that section. The foundation component of ICD-11 is a network of knowledge placed into a database. It's from the foundation component that a linearization and country-specific modifications are built. And that's what they want you to know. So they start with this foundation component, and then countries then develop their own clinical modifications for it as they choose. So right now, under linearization, ICD-11 is MMS. Eventually, when it comes to us, it'll be ICD-11-CM and ICD-11-PCS. But we're a ways away from that right now. Anyway, ICD-11, WHO has a collaborative open development and maintenance process. They're continuously updating it. They have an annual official release. It has already started being used. The first version was made available in 2018. The member states have agreed to adopt it. They agreed to adopt it in May of 2019, and they're going to start using it with reporting January 1st of 2022. Now again, that's not the US, but around the world, there are countries who will start using ICD-11 January 1st of 2022. It reflects scientific and medical advances. It can be integrated with EHRs. It's easy to implement, accessible, easy to use, improved links to terminologies and derived and related classifications. The biggest jump was between ICD-9 to ICD-10. That really changed how it was laid out, how it worked. ICD-11 or ICD-10 to ICD-11 is not going to be that significant of a jump as it was from 9 to 10. I mean, obviously there will be training. It's introduced to you here because by the time you complete the program in 2022, you may be hearing more about this, and we want you to be educated on it. Now, again, it's meant to be here as sort of a taste as to what's going to happen in the future. It's not meant for you to memorize every little detail about ICD-11. For example, you probably don't need to know that it's going to include, for the first time, ancient Chinese medicine disorders and patterns, or the fact that it's going to have a new chapter for sleep-wake disorders or conditions related to sexual health, and that it's going to have extension codes. Those are probably not things that you're gonna need to know today, but you should be aware of them and try and keep them in the back of your mind. What you do need to know is that with ICD-11, it's made up of STEM codes and extension codes. And a STEM code, oh, I went through this, sorry, I got behind. A STEM code, and this is at the bottom of page 137, is a standalone code that can be a single entity or a combination of clinical detail. An extension code will always start with X and adds detail to the STEM code. It must be used with it. You can't use an extension code without a STEM code, but you can use a STEM code without an extension code. And they are they use a forward slash or an ampersand when they're looking at codes that belong together. And your book does a good job of going through this. And I will tell you there is a question on the quiz about STEM codes and extension codes, so you want to be familiar with those. I don't actually ask you to code, I just ask you to identify STEM codes and extension codes. So again, you're not going to need to know that it has a minimum of 4 characters, and the first character is either a letter or number and signifies the chapter number. You don't have to know all that to that detail, but you have to understand some of these things. So let's move on to International Classification of Functioning, Disability, and Health, ICF. This is used to measure health and disability. You can get paper versions or online versions, and again, it's assigned by a health professional, not necessarily a health coder, but a health professional. So notice that. These are, again, used to identify what is happening with disability. So you want to be thinking rehab with a lot of this. So you're looking what it's looking at with functioning is body functions, body structures, activities, and participation. Disability is looking at impairments, activity limitations, and participation restrictions. And they give you good examples of this. This is pages 138 and 139 in your book. You need to know what ICF is and what it's used for. And I guess I got ahead of myself because here it is. All right, ICD-10 is International Classification of Diseases for Oncology, and they're now on their 3rd edition. This is a derived classification. It is used by tumor or cancer registries or registrars. It reports the topography and morphology of neoplasms. It is available in print and online. So again, you probably don't need to know that this is used, that it's a dual classification system, but you do need to know that is for topography and morphology of tumors, that it's used in cancer registries, and that sort of thing. You need to know those. You don't necessarily need to know the 5 major sections today. Again, this is to introduce you to it. We'll go back to it in other classes that you have, but this is just to make you aware of that. So moving on. Oh, sorry. Yes, there we go. It's got greater detail of the histology than ICD-10. So that's why a lot of the registries use ICD-03. DSM-5. This is Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This is on page 140 in your book. Goes through this. You need to know that it's a classification system for mental disorder. It was developed by the American Psychiatric Association. Make sure that you know that. Hint, hint, hint. American Psychiatric Association classification system for mental disorders. Again, available print, online, and software applications. It helps a clinician determine that someone has a mental disorder and which one do they have. You also need to know that ICD-10 codes are incorporated into DSM-5. Make sure you know that important fact, and that it's used for clinical assessments, developing treatment plans, and communicating between healthcare providers. So now we move on to code systems, and this is page 141 in your book. Okay, so what's a code system? It's an accumulation of terms and codes for exchanging or storing information. It's a broad term. Characteristics of a terminology or a classification, and primary or secondary data use. Those are the concepts we're going to talk through. I am not going to spend a whole lot of detail on this with you. I want you to read through your book and just be familiar with the different ones that they give you, like LOINC and HCPCS, RX norm. Those are the main ones that it looks like that they cover for you in the next several pages. Just make sure that you understand what they are and what they're used for. So I'm going to skip through here and let you just read through it and study it in your book. And again, we will come back to these again in other classes in this program, but this is just to introduce you to it so that you know what these are. Health data and information sets. Now we move on page 145 into data sets. And a data set is a list of recommended data elements with uniform definitions used for national and state statistics, clinical decision support, and clinical quality measures. So examples of these are OASIS, HEDIS, UHDDS, and the clinical or a common clinical data set, the CCDS. These are again in your book from pages 145 to 147. I want you to read through your book and be familiar with these and understand what they're for. For instance, OASIS is home health care. You just need to know that that's home health care and that it is looking at, it's going to be used for administrative claims and health record stuff, and that so that you just need to know that. So OASIS is home health related, and it is used for billing and process and outcome measure improvement measures. Then you've got HEDIS. These are by NCQA, and we will spend lots of time on HEDIS in the future. You just need to know what it is and what it does. Again, same with UHDDS and Common Clinical Data Set. So then we get to Database of Clinical Terminologies, Classifications, and Code Systems. And this is bottom of page 147. UMLS, what I want you to know here is the knowledge resources. The fact that they include the meta-thesaurus, the semantic network, and the specialist lexicon. You need to know that for the quiz. Hint, hint, hint. So just make sure that you understand UMLS is a centralized location of health and biomedical terminologies and standards. The knowledge resources include meta-thesaurus, semantic network, and specialist lexicon. That's what you need to know with that. And then this talks about what a meta-thesaurus is, and it should also explain the rest. And that is the end of this chapter. So that's it for chapter 5 for week 12. I hope you have a great week ahead. Take care.